Ted Bingham. Ah, crud. Ted Bingham just keeps resetting every single time I scroll. Ted Bingham. Healthcare, for example, partly so expensive because so many people default, which raises healthcare costs. If we gave death penalty for not paying, would actual price of many things be lower? No. The price of healthcare is cost so much because insurance costs so much. The entire healthcare industry is built upon private insurance, and private insurance hates paying for things, so hospitals then have to overcharge to get their money's worth out of the insurance companies, and then negotiate down to what's still an extremely high price. Most hospitals are nonprofits and are legally required to forgive any of the healthcare bills for anyone who makes 3 times the federal poverty level or below. They don't. They oftentimes will send creditors after these poor folks and try to squeeze every penny out of them when they should be giving this care for free because they're a nonprofit hospital. Healthcare is expensive because we have too many administrators and people are trying to make a profit off of it. You remove the profit incentive and keep an altruistic system like most nations around the world, all of a sudden healthcare costs drop a lot, becomes better service for everybody. You eliminate millions of administrators that we have now. Just imagine every doctor you know is not necessarily an employee of the hospital. They have admitting rights, right? Admitting privileges. They literally rent the space they're in from the hospital. So you'll get a bill from the doctor, you get a bill from the hospital. Those 2 bills combined are your medical expenses. That doctor has to hire accountants and nurses and the people who facilitate their payment schedules for them, their accounts receivable, etc. And the doctors spend a lot of time focused on billing when they should be spending that time treating patients, because our private healthcare system is so messed up that they're just not on salary like they should be. They have to do billable hours and figure all this stuff, all this paperwork. So the layer of bureaucratic administration between the doctors efficiently using their time and getting to the patients is obfuscated by this incredible bureaucracy that's set up to figure out how to pay for all this. If you just nationalized it, if you just made all the hospitals federally owned, you put all the doctors and nurses on salaries, and you said, hey, treat people as they come in. That's your job. You would need a couple of administrators to make sure that, paper products got ordered and pharmacy got stocked, and etc. But you wouldn't need to have all of these billing people filling it all out. There's 800,000 doctors in the U.S., and there's 2.2 million administrators. That is not a sustainable system. We should have probably 2.2 million doctors in the U.S. And maybe 10,000 administrators, 50,000 administrators. That's about it. That'd be enough to run the hospitals if we were nationalized in a universal system. But most people can't pay their healthcare bills because, well, their healthcare bills are insanely expensive. You get cancer, $1 million. Oh, you make $45,000 a year? You don't have $1 million? Tough shit. Pay us. We're going to take your house and your car and everything else. You probably got fired from your job because all your chemo you're going on. Like, we can't deal with this guy anymore. He's not showing up to work. We just need to have a much more humane system that focuses on just taking care of people. And the economy would do better as a result. Because 30%, 30 cents on the dollar of every healthcare dollar you spend goes just to the bureaucracy of the health insurance company. 30 cents. You want to save 30% right off the top? Murder the health insurance companies. Yeah. Okay. Where was Espino Johnson? Universal healthcare takes many weeks for an appointment, subpar service, and far too many denials for care. Very sad system. Everyone always says this, and then they find out that wait times in America are just as long or longer than any national healthcare system in the world. You want to get elective surgery, knee surgery, whatever, you're looking at 6 to 9 months before they'll have an opening for you. Especially seeing specialists, you're screwed. And it's going to cost you a fortune in the process. For the price of my mom's hip surgery last year, which she had to wait several years for due to COVID and everything else, she could have gone to Spain, rented a villa on the beach, and lived on the beach for an entire year and paid for her surgery. That would have been the cost for her as an American to go get her hip surgery in Spain. Instead, she comes to America, they do her hip surgery, and the next day they're like, get the fuck out. Like, it's crazy. When I was in Norway, I stayed in a hotel at a hospital, because in Norway, you know, if you got to stay, your family might have to stay with you, so they get a hotel room that's attached to the hospital, so you can rent the hotel room if they don't have too many people in the hospital. And at that hospital were all the new mothers with their little bassinets, and they're getting breakfast, the continental breakfast, and they're eating, and they'll stay in the hospital for like a week or 10 days because they want to make sure that the baby's latched, that the mother is healing, that all this stuff, take care of themselves. Here, you have a baby, they're like, get the fuck out. It's such a terrible system. And their system, while taking better care of their people, costs half the price of ours. Half the price. Their hospitals were so nice. Absolutely amazing hospitals. And ours oftentimes look like crime scenes with like bulletproof glass you gotta talk to somebody through. And it's just, our system sucks, man. Espino Johnson, just travel the world. I think part of the problem is that you may have never traveled and gone other places and seen that sometimes other countries might do things better than us. They have better public transportation. They have better hospitals. They've got better schools. They have better walkable communities and a healthier population. There are places that are better than Oklahoma. Like, they just are. So I strongly encourage you to get your passport. Go visit some countries. Don't visit them as like, I want American stuff. Go and experience how they live and see the difference that is there. And perhaps it'll awaken something inside of you where you go, oh my gosh, this is actually a better system than what I'm used to. I feel healthier and more vibrant, and the community is better and nicer. It's just go experience something outside the norm, something outside of Oklahoma. I think it will awaken something inside of you. I remember what was I waiting for? I was in the doctor's office for something, and a woman came in because she was trying to make an appointment for a mammogram. And they're like, oh, it's going to be like 9 months. She says, 9 months? Like, what if I get cancer in the next 9 months? Like, I need a mammogram now. And like, oh, it's like 9 months. So something that goes like, honk, squeezes your boobs and is over. And someone looks at it and goes, cancer or no cancer? 9-month appointment for that. So yeah, it's not necessarily quick in our system. That's for sure. Espino Johnson, don't be glib about appointment timeframes, Houston. You're smarter than that. NIS, Cuban healthcare, Chinese system, etc. Terrible. And yet, they all have longer lifespans than the United States. Weird. Their wait times are longer, but they all live longer than we do. Interesting. We're the only industrialized nation whose lifespans are shrinking. So our system sucks, Espino Johnson. You're talking to somebody who went bankrupt at 18 because I was a victim of a hit and run. Like, our system sucks. If you do get care immediately, it's unaffordable. And if it's unaffordable, then what can you do the rest of your life? You're bankrupt. You're out. And the cat's now yelling to get back in. Yeah, now I'm back in, you ding dong. Come on. There you go. You did your thing, got outside, now you're back in. Yeah, hi, buddy. So, yeah, our system is terrible. Like, let's say your appendix bursts. You have an unfortunate event, your appendix bursts, you get taken to the emergency room, get your appendix out. You're gonna be in there for a while because if it's burst and you go septic, you could be almost dead, and you know you're looking at probably $50,000 to $100,000 just for the surgery, and any other time after that might be $1,000 an hour while you're in intensive care, and you could be looking at $150,000 for your appendix bursting, right? Your appendix bursts in France, you get taken to the emergency room, They fix you up. And when you leave, they give you money because they're going to be like, don't go to work for like 3 weeks and don't pick up anything more than 5 pounds for a couple of months because we had to cut your abdomen open. Like, you know, you get pregnant in France and you have a baby. Right? Everyone shoots for a May birth for their babies. They try to plan it if they can. So there's lots of babies get born in May because if the baby's 3 months old, it qualifies for free daycare, right? And the daycare admissions happens at the end of August every year. So the goal is to get your baby by May so that you can have your free daycare provided come August. Not only that, but the government twice a week for the next year or two sends a woman to your house to, not necessarily a woman, but someone to your house to help you do things so that you can take care of the child or have a break from the child, right? Because you're postpartum, your brain's getting scrambled, you have nothing but this baby all the time, you need someone to talk to, they'll help you fold laundry, they'll prepare a meal for you, you know, they'll watch the baby while like you can like go to the bathroom and not have to like take a child with you for once. These systems in these other countries are so much better than what we have. And they're cheaper and they provide more service and you're not going to go bankrupt. You get cancer in France, they'll take care of you. They'll pay for all the treatment. And when you're done, they'll pay for you to have a vacation. Why? Because you just went through fucking cancer. And they'll be like, you know what? Here's enough money for you to go on vacation for the next 5 weeks. You don't have to go to work until then. So go to the Canary Islands or whatever. Enjoy yourself. Go live it up and celebrate the fact you just got over cancer. And you can come back. And their system is still half the price of ours. Like, American healthcare sucks so bad. In 2000, the WHO came out with the rankings of healthcare systems. We finished below Cuba and one above Costa Rica. We're at number like 38 in the world because our access to healthcare is so terrible. Because some people don't have health insurance to begin with. And when they do have health insurance, it's still prohibitively expensive. Like, what are you supposed to do with a $15,000 deductible and $100 copays with your bronze plan or whatever you're stuck with off the healthcare system, off the healthcare.gov? Like, oh, I'm going to have to make sure that I have a major accident so I can finally meet my $15,000 deductible and get some decent healthcare after that. That's not how we should be living our lives, man. It's just a terrible, terrible, terrible system. Truly awful. We can do so much better. All we have to do is look at other countries that do better and go, why don't we do that? It's that easy. Maybe hire the person who runs their system. Like, hey, be a consultant. Tell us how to make the system work well. And the first thing they say is, get rid of your health insurance companies. Or make them all nonprofit, which is what Switzerland and Taiwan does. No, sorry, Switzerland and Japan make all their health insurance companies nonprofit. And they have half the costs. Even Switzerland, the second most expensive healthcare provider in the entire world, is still like 60% of what we pay. And we pay so much for such a terrible service. So, as Espino Johnson, get out of the country. Just go on, get out. I want you to go to another country and have a major medical event. And have a heart attack, get hit by a car, something like that. And you're going to see just how shitty our system is. Like, in America, you could be dying from a gunshot wound, and the first concern that's going to pop up in your mind is be like, make sure they don't take me by an ambulance because I can't afford the $3,000 ambulance ride, which is just mind-blowing to other people around the world. They're like, wait, your ambulance ride costs $3,000? Isn't it just like you get in a car and you go somewhere? Like, yeah, they charge you $3,000 for the 15 minutes you're in the ambulance. Our system is so stupid. It's so dumb. So dumb. So free your mind, man. Go travel. Jay Geyser, Michael Moore, Sicko, Investigating Healthcare in the United States, 2007. That one is actually phenomenal. A lot of people will be like, Michael Moore. Michael Moore specifically went out, and he didn't talk about people who are uninsured or the people who are on Medicare or anything else. He only did stories on people who have health insurance and how they got screwed because the health insurance companies arbitrarily deny coverage, refuse to pay, say that someone's out of network, whatever. And it's completely arbitrary. They just like spin a wheel like, yeah, we're not going to pay for that one. It just sucks to be you. You know, you've been paying your bills and your employer's been paying whatever. Like, it's just so dumb. I mean, you get stories. I think I'm going to talk about this in that show. Like a dude in an industrial accident lost 4 of his fingers, and the health insurance company would only pay to reattach 1 of them. So he had to pick which of his 4 fingers he lost he would like reattached, because they wouldn't pay for the other ones to get reattached. Dude, like, we can do better than that. We can do better. You just put the doctors on salary and they just do the job. The salary would still be insane. It'd still be like $500,000-$600,000 a year. That's what it is for NHS doctors. So, and what? So some guy at Aetna won't have a $30 million bonus at the end of the year. I worked with a girl whose grandfather was the CEO. I think it was Aetna. He was the CEO of, and they lived in the just biggest house, and they had a big ski and ski out lodge in Park City, and they owned like a piece of an island in Bahamas and everything. And they were the greediest, stingiest fucks I've ever met in my entire life. Like, type of people that will tip $5 on a $200 dinner. Those type of people. And their granddaughter, you know, moved here to help take care of them in their old age, and then they charged her rent. She's like, honey, we need you to come up here and help take care of us because, you know, we're getting old. And then she's like, oh, okay, I'll help take care of you guys. And then they're charging her like $700 a month for rent. Like, that's who's running your healthcare systems right there. Not a doctor, just some MBA douchebag. The house was really nice, though. I'll be honest. That was a very nice house. Sold a little while ago for like $10 million.